right, thank you for staying tuned. You're still watching CMI this morning on ITV, the Thursday edition. My name is Ugochukwu Bamidele. All right, it's time for us to focus on some really interesting stuff. The 12th of October this year happens to be the World Sight Day. Now, not like there's a fixed date for it, but basically what happens is second Thursday in the month of October every year is set aside to, draw attention to, eyesight, vision, and, causes of blindness. So we're going to be looking at that in commemoration of the World Sight Day today, all right? And so talking about, drawing attention to vision, when you talk about vision, you definitely think of, the professionals that handle issues around that area, ophthalmologists. And then talk about correcting eyesight also. You would also look at, the optometrists. And so I've got them, in the studio with me this morning. I've got Dr. Nusa Ogbevoin. He's a consultant ophthalmologist. Many thanks for joining me this morning.
You're welcome. Thank you so much.
All right. And Dr. Mrs. Femi Obaza is also a consultant ophthalmologist. She joins me this morning. Thank you very much for your time. And Dr. Michael Woko, who happens to be the Edo State Chairman, Nigerian Optometric Association. I thank you for joining me.
Thank you so much for having me.
Okay. Let's start off looking at, commemoration of the World Sight Day. Across the world, today it's being observed. Here in Nigeria, are there plans, are there programs across the country, or is it just about, Edo State? Let me start with Dr. Nusa.
Yes, thank you very much. Actually that blindness is a very topical issue, and the World Sight Day actually is to create awareness of the effect of blindness and visual impairment, because we have noted that it's a public health issue. And so all that is being done is to make sure that people are aware. And here in Edo State, we actually have in mind to come and create this awareness, and of course that is part of the why we are here, to make people know about it. Apart from that, there are other outreach programs that are also planned outside the studio now.
Okay.
And like today, there's a screening program, the screening program that will be going on in the University of Benin Teaching Hospital,
all right,
so that people can be, examined.
Can get to find out, if they have eye problems and how to go about it.
Really.
Okay. Just before I come to Dr. Femi, let me ask Dr. Michael. I mean, every time people have problems with their eyes, the first thing they want to do is see any doctor. I mean, how much of awareness has been put, into drawing attention to optometry as a profession, especially here in Edo State, where literacy level is not, on the high side?
Thank you so much for that question. That is actually the reason why we're here, to commemorate World Sight Day 2017. The World Sight Day is a global initiative by the World Health Organization in collaboration with the International Agency for Prevention of Blindness to raise global awareness with respect to conditions that can predispose the individual to avoidable blindness and what members of the public can do to avoid them. And so the Nigerian Optometric Association, which is a prime advocacy group in Nigeria, which is also a stakeholder in the healthcare delivery system in the country, an affiliate body of the World Council of Optometry, African Council of Optometry, an umbrella body of over 4,000 registered optometrists in Nigeria, have joined the international community of over 154 countries to commemorate the World Sight Day 2017. And in this year, the association deemed it fit to focus on vision amongst children, because we have come to realize that children make up the vulnerable group in the society, and to a large extent, any sort of visual impairment will go a long way to undermine the ability of that child to actually have good quality vision, and that will also undermine the ability of that child to pursue the vision to the fullest.
Right.
And so what we are trying to do is to see how we can, across the country, organized screening program for over 150,000 children across the country today. The idea is to be able to raise a database as to the prevalence of visual impairment amongst children in the country, so that the government order will be able to plan and make policy arrangements so as to be able to address these issues. And you will agree with me that in as much as 80% of economic activities involve sight,
Okay.
you come to the irresistible conclusion that talking about enhancing good quality eye care is even more of economic importance and value than a humanitarian service.
Okay, I'm going to come back to you. Just hold the rest of your thoughts on that one. Dr. Femi, let me quickly ask, looking at the call to action for this year, which is Make Vision Count globally, as an ophthalmologist and, you know, a consultant at that, how much of action would you say, you know, in your field has gone into creating awareness? Because I think there's just not a whole lot of people aware of, you know, the profession of ophthalmology, first of all, and then what exactly you do. So let's start it from there.
Well, the Association of Ophthalmologists has worked very hard, both globally and locally.
Okay,
We do a lot of advocacy.
all right.
We do run quite a few programs for public enlightenment.
All right.
We go to schools. We have very elaborate programs. We go to schools, we go to offices, just to enlighten people more, and then to do certain things about that can be done to help in reducing those areas of blindness that are preventable. Like Dr. Grabal said, sometimes we have screening exercises in schools and in other public places
Okay.
to try to screen out early cases that could tend to blindness if they are not well taken care of immediately.
Okay.
There is a lot of ignorance, and we're trying to step up our efforts in
Alright.
trying to get people to be more aware of the fact that it's not everybody that will treat eyes. You know, sometimes you just feel like you rightly said, any doctor can treat the eye. It's important for people to understand that there are specialists in eye care and that they need to see them early, because a lot of things can be done to prevent blindness if the right people are seen in time.
Okay.
So we are working hard at it.
Alright.
We just need, we are trying to get the government to give us more support, because a lot of the problems we experience is because of ignorance. in the society.
And please, just to add to what she was saying,
Okay.
the Ophthalmological Society of Nigeria has really been doing a lot to that effect. Recently, the pediatric ophthalmologist and strabismus group of the Nigeria Ophthalmological Society, we organized a screening program that took place also in the Federal Staff School for those children. And in fact, everybody was happy. We were able to pick up some cases there, which people hitherto were just ignorant of. Case of pediatric cataract, strabismus, and so on. And of course, from the University of Benin, we have community outreach. Of course, we've been going to various communities. We've been Keadolo. We stayed quite some time there, some time ago. From there, we moved to Ikpobaoka. We liaised with the primary health care centers, and there, of course, every Thursday we go out for these community outreaches where people are being.
I'm pretty impressed by what you've said, but let's look at our society in Nigeria. People are drawn to the media, especially the young people.
Yeah.
Social media, conventional broadcast media, print, and all of them. So I'm asking because you would hardly see any awareness program in the media, whether on social media, which is something that's free for all right now,
Exactly.
or broadcast media, TV, radio, and the newspapers. You would hardly see,
Yeah.
and these are avenues that most people get information from. That's a little bit of where I have an issue right now. And
Exactly.
for instance, if we don't talk about the World Sight Day today, it means a whole lot of people are not even aware of the fact that today, globally, is World Sight Day, and this is different from what you find in other parts of the world. There's
Exactly.
more social media awareness, there's more television and radio awareness. So what's the plan, as regards augmenting and making up for all of these lapses? Because I think it's some lapse as regards
Yes.
awareness.
We realize there's a gap,
Mm.
and the association, Ophthalmological Association of Nigeria, is really working hard to kind of bridge that gap.
Okay.
We, like Dr. Musa has said, we already started doing things, on a local level, but we agree that the media hasn't been used as much as we should.
Okay.
And oftentimes, a lot of that has to do with the finance, can be difficult. But these days, like you rightly said,
Mm.
with the social media, it reaches into, it has so far reaching. So we are
Okay.
having plans to put up, little posts and things that can be circulated to give correct information to people.
It's okay. All right, quickly, for some persons now, an optometrist is an eye doctor, which I don't dispute to some level. For some other persons, you say, go see an ophthalmologist, and they're like, where do I find them?
Yes.
All right, so let's just set the difference. An ophthalmologist and an optometrist. What's the difference? Let's throw light on the optometry part.
It's okay.
Who is an optometrist?
Well, the
Dr.
optometrist
Mike,
is the first contact eye care practitioner who has received proper training in the university
Okay.
to be able to diagnose eye conditions
Okay.
and treats minor ocular problems, doesn't pose a threat to the integrity of vision, and also dictate conditions of refractive error
Okay.
and give corrections accordingly. Also look at issues of binocularity and equally provide solution.
Okay.
As a first contact eye care practitioner, he sees the patient first and also referred to a secondary practitioner.
Okay.
Well, the National Health Insurance Scheme have also made the delineation of duty so clearly, apart from the fact that professionally we are all bound by our professional ethics, thereabouts, and the professions are clearly regulated by law.
Okay.
You would realize that, to a large extent, both are stakeholders in the eye care delivery system.
Okay.
The eye care delivery system is so structured in such a manner that you have the primary, care, you have the secondary care, and the tertiary care,
Okay.
thereabout. And so the optometrists are more involved in the primary care, aspect, being the first contact eye care practitioners, etc. And what we do, we try our very best to ensure that we create this awareness amongst the people, particularly the young people, like as you said. And you talked about the social media, otherwise known as new media. You realize that if you want to really, if you want to catch the youth, then you should be able to, a large extent, make information available to them at the social media level. This is what we are doing with precision. You remember during the last national conference of Nigerian Optometrical Association, which was hosted here in Edo State, where over 2,000 optometrists from both within and outside the country converged here in Benin City. It was really an advocacy outing, wherein the state governor himself was on the ground and unveiled, strategic healthcare policy, for the states. It was a whole lot of advocacy outing, and we deem it fit to use that opportunity to create awareness as to who an optometrist is, what the eye care delivery system in the country is, determined, towards ensuring that, it guarantees the visual welfare of the people, and also to a large extent, make people to understand the need for them to take their vision very seriously, because you can imagine a world without vision.
I don't even want to imagine it. I don't even want to imagine it. Okay, so basically what you're saying is an optometrist is the first contact, for someone that has eye issues.
Yeah.
That's the first person it comes in contact with, and then you're able to tell if it's something that should go to the secondary care, and that's where the ophthalmologists come in right now. So let's exactly who an ophthalmologist is.
Well, in medicine, we usually work as teams,
Okay.
and it's not different for eye care. Eye care management is done by a team of eye care professionals.
Okay.
At the head of the team, you have the ophthalmologist, who is a medical doctor.
Mm.
The person has trained and finished the first degree in medicine, and then has gone back for further specialist training in care of the eye.
Okay.
Just like somebody else might do surgery or pediatrics,
Mm.
children. So, then we organize being at the head of the team, then we organize the others who help. We have the optometrists, like you has rightly said. The optometrists in many places may be the first port of call,
Mm.
because they help with the initial examination of a patient. Many times the patient may just find that he needs glasses, and that's where the optometrist is useful, because that's where their training is geared for.
Okay.
Training in how to fit people with glasses, or those who have vision problems that can be corrected with glasses.
Okay.
Anything other than that will be referred to the ophthalmologist. So we take care of the medical conditions, we do the surgeries
Okay.
for patients. In many cases, we might also, prescribe glasses, but because of the volume of work, it's necessary that we should have a department where that can be done, and that's where the optometrists are very useful.
Okay.
Then we still work with ophthalmic nurses. These are nurses who, they've done their general training in nursing,
Mm.
and they now went back to do more training in
Specialize in eye care.
Yes,
Mhm.
assist with eye care.
Okay.
And of course, we have the opticians who help with the actual fixing of glasses. So
Okay.
the ophthalmologist is basically a doctor, a medical doctor, who has specialized further in
Mm.
how to take care of the eye. But we can't do the work alone. So we have the different groups I've mentioned who assist. They're like paramedicals to help in taking care of making the whole thing work together in harmony.
Okay. All right. I'm sure that's a bit clear now. For a whole lot of persons watching this morning. But let me come to you, Dr. Nusa. At what point do I know that I need to see an eye doctor?
Okay. Ordinarily, all right, individuals, whether you have symptoms or no symptoms, we are supposed to have regular eye check, at least once a year. Okay?
Some persons would say, I don't have that kind of money.
Exactly.
That's the thing.
So, but here, we don't have that, but here, in this part of the world,
it's not common stuff
it's not
for us,
common.
yeah.
Yeah, but when you should know that, you now think of, when I need to see a doctor. Now, if somebody have, for the emergency cases, you know that you just have to see a doctor. Maybe you have trauma, those that do with accident, chemical injuries, and others, then definitely. But for outside those of emergency, sometimes you might observe that you are not seeing well. Okay? You are not seeing well. There are some people who are just managing. And occasionally, people don't even know. Sometimes, some had just accidentally found out that, maybe they cover one eye and see that one is seeing better than the other. At some point, you should know that you should go and find out. But most of the time, we see people managing. They just manage. And there are myriads of eye signs and symptoms, tearing, redness of the eye, itching, and so on. You are supposed to see a professional advice, because we found out that a lot of minor issues that would have been taken care of at that level, because of ignorance, then the desire to seek a quick and alternative, curative means, they complicate issues, so that before they come to the eye specialist, it may even be too late. So, and there are even conditions that may not even give any signs. Like maybe you should be aware of the dreaded glaucoma.
Yeah.
So it may not give sign. The time probably the person will know that, I'm not seeing well. For a glaucoma patient, it may even
It's
be
already at its advanced stage.
Advanced stage. So
Okay.
when you have any issue, problems, issue, you should just see a doctor. Yes.
The days are past where people were not, at least many people in the society are
Yeah.
And I think a general rule is that anybody who has any form of issue with their eyes, something is wrong, they should seek first to see the, to go and see the eye doctor. It's very important.
Well, but you'd also agree with me, Dr. Femi, that there are times when you don't even know you have eye problems.
Yes.
I was going to ask right now, how do I check my eyes on my own before coming to the hospital? He mentioned you close one and you notice you're not seeing well with the other one. Would I wake up in the morning on a normal day and decide to close one and check? I'm rushing out of the house and then closing the other one.
Can I quickly say something there?
That one was
Just before you come in,
You see,
Dr. Mike. Yeah.
like you rightly said, it's the practice all over the world now.
Okay, so I'm asking, what can I do? Just like I wake up every day, before I kick my car, I want to check for water, I want to look at my tires, I want to check my oil, and be sure my lights are working. So what can I check every day? What kinds of check can I do every day?
Well, first of all, you can look in the mirror.
Look my eyes in the mirror. Okay.
You might notice a lot of people are surprisingly, it's somebody else who tells them there's something wrong with your eye.
Okay.
Your eye is red. So but you could have done that at home, and I'm sure most of us look in the mirror.
So if my eye is red, I see a doctor immediately.
So you should. A red eye is usually not okay. It might be a minor problem, but definitely eyes are not supposed to be red.
Okay.
And of course, like you rightly said, it's not something we will do, but yeah, maybe once in a while you should cover one eye and check and be sure the two eyes are seeing the same.
Okay.
But generally speaking, once you notice that something is unusual, that's the time to go and find out. It's better to hear that there was no problem than to say, well, I thought there was no problem. It turns out
That's a big problem.
And like we said, all over the world, people are doing, annual health checks. Prevention is better than cure. That's the slogan now.
Okay.
So it's better as part of your general physical, checkup. Examining your eyes is a fantastic way of making sure that you can prevent certain problems from going too far.
Okay. All right, Dr. Mike, you wanted to say something.
Okay, yes, in just trying to contribute in that regard of ensuring that individuals go about routine eye check. In fact, what we optometrists advocate is that the individual should go about regular eye check at least twice a year. The reason is because there are a lot of conditions that can set in gradually and painless. Just like as you mentioned, glaucoma is one of them.
Okay.
That's why the type of glaucoma that is more prevalent in this part of the world.
Right.
It occurs gradually and it could be painless, no symptoms, etc. And so the individual may not just know, not until you go about regular eye check. And of course, early detection of those kind of conditions is really key in effective management. And so we advocate, twice, a year, regular eye check twice a year. And programs like this usually will afford us the opportunity to deliver our message. And our message is always very, very clear to members of the public. That one, you go about routine eye check on a regular basis twice a year minimum. Then you should avoid cultural practices. Some people do all sorts of things. We have seen cases even in practice where someone who presents with itchy eye or wasi discharge from the eye and all that, purulent discharge from the eye. And the patient tells you that the mother-in-law have just advised her to apply breast milk in the eye of the child. You can imagine that will create a medium for even the bacteria that is causing the condition to thrive more. Some have even gone to the extent of applying physics in their eyes. There's a particular case that happened in the western part of the country where somebody presented with itchy discharge, watery discharge, etc. A mechanic and a colleague asked him to go and apply raw acid in the eye. And of course, he went about it, applied raw acid in the eye. And of course, the results, was not really far-fetched. And he was, sent to the hospital, and that eye had already gone, and he was advised for, enucleation of the eye. That's the total removal of the eye, etc.
Wow.
You see, these are the cultural practices that most people should avoid. Okay, so in order not to predispose, their eyes, to conditions that can lead to avoidable blindness. Avoidable blindness actually means that it could be avoided. But what is important is that what are the members of the public expected to do in order to really avoid these conditions? And each time they come to us as first contact eye care practitioner, empowered by law, okay, in the country as first contact eye care practitioner, you will agree with me that the kind of counseling that the individual gets on that first visit is really germane as to the quality of care that will be given to that individual.
Okay.
And of course, you know, the follow-up of that condition and then the results thereof.
All right.
So that is why we're taking our job very, very seriously. And that is why we are combat-ready optometrists who have received proper training, who have gone to the university studying everything about IRI from 100 level in the university to the, you know, final year in the university. Are combat-ready on ground. And that's why we equally advise people to ensure that they visit registered eye clinics. Okay, where you go to equally matters. We have seen a lot of...
I was also going to come to that because I wanted to talk about the issue of regulation.
Yes.
As an association, I'm sure there should be measures in place to regulate practice and then check quackery. And most of the time you find the guy on the street selling fancy glasses, having some form of medicated glasses also. You find an old man that has an eye problem, you know, he knows he's short-sighted quite all right. And so he goes to that guy that's selling glasses, hawking glasses on the street, and he's looking for, give me this one, let me see the number, and he's looking at it, and he buys from that guy. So what are you guys doing to check that? Because I think, you know, if I'm supposed to buy glasses, it should be recommended from a professional, an optometrist.
That is correct. You see, this is a very, very serious, you know, a challenge that we have, the issue of quackery. And that is why the association is really determined towards ensuring that we mitigate the activities of quacks.
Okay.
You know, because to a large extent, quacks are part of the, you know, problem that we have in a society that can even endanger the vision of the individual. While we are working very hard on a daily basis in trying to ensure that we, to a large extent, through our activities and practice, guarantee the visual welfare of the people. We should, on the other way, also check, you know, areas in which criminally minded individuals are working in, you know, in trying to ensure that the vision of the individual is undermined.
Would you call that criminal-minded someone selling glasses?
Yeah, of course. If the individual,
to him, he's selling glasses, whether recommended
and that is why he needs to know. That is why he needs to know, because
how much of awareness has the association put into that? That takes me back to the question I asked earlier, because when there is awareness, the guy selling knows I'm not supposed to sell this kind of glasses. And so if I'm found selling it, it means I'm in trouble.
Good.
Would you blame him for not knowing? That's my question.
Yes, see, firstly, what we do is that the first round of awareness begins with the patients.
Okay.
Please, if you have any issues with your eye, no matter how minor you think it is, visit a registered eye clinic. We begin from there.
Okay.
And that we equally warn them against patronizing quacks, etc. Now, we have carried out series of awareness programs. I remember 2 years ago, the regulatory body of the profession, the Optometrist and Dispensing Optician Regulatory Board of Nigeria, empowered by, you know, an act of parliament, CAF 09, Laws of the Federation 2004, formerly known as Decree 34 of December 1989, to regulate the profession of optometry in Nigeria. They visited every state of the federation, combing the nooks and crannies, potential flashpoints for, you know, operation of these quacks, etc. And we achieved a whole lot of results. A lot of people were arrested, and we have a lot of cases in court right now. And by so doing, it will serve as a deterrent to those people who think that they can practice the profession through the back door.
Okay, don't you also think optometrists sell these glasses to these guys that sell fancy glasses?
Not really, they
so
don't.
Where do they get it from? Because I know the optometrists has to do with the glasses.
Good.
So how does a roadside motor park fancy selling glass or a hawker gets medicated glasses?
Good. Now, down the line, we have the Optical Dealers Association. In fact, what we're even trying to do is to ensure that they are organized. Because currently, the board, the regulatory body empowered by the Act of Parliament, regulates the professions of optometry and opticianry. So when we're under the same umbrella, you now realize that we are guided by professional ethics. And so when you do anything outside your professional calling, then you run far of the law, and then, you know, you pay dearly for it. Now, but there is a group, they call themselves Optical Dealers Association, but before now they have not been registered. What they do is that they get these, you know, glasses, you know, etc. Both the sunshades, they don't medicate.
Are they trained?
Well, most of them are not really trained. You see, what we are trying to do right now, because we feel that this strategy will also go a long way in helping to mitigate quackery in that regard, because it's a challenge. Now, the board has come up with an idea, you know, to have them registered so that they can be effectively regulated. So that when they are regulated, their attention will now be drawn to the provisions of the law with respect to dispensing glasses. Because for you to dispense glasses, no matter what, for you to dispense glasses, you must be armed with a license to do so.
Yeah.
And these things are within the purview of the professional ethics. So I have a feeling that by the time they are registered and effectively regulated, that will reduce quackery in that regards.
Okay,
While we're equally addressing other areas of
just so we don't waste time on this, but
Yes,
I'm sure you would also agree that there's a whole lot your association needs to do,
Of course.
especially since you're the chairman in Edo State. Because my next question would have been, how far have you gone with enforcing all of this you've mentioned here in Edo State? But let's
we do. We have a task force on the ground.
the thing, having a task force is one
Yes,
thing.
yes.
Prosecution is another thing,
Yes.
and that's the only way to keep people.
Yes.
That's the only way to deter people from
That
doing
is
crime. If you
that is
prosecute
correct.
appropriately, people wouldn't do crime. That's
That
what
is
I think.
correct. That is
All right, let me come to Dr. Femi right now. Let's look at, in line with the World Sight Day, what can I do as an individual? I'm not a doctor, but what can I do to, prevent blindness? What can I do to prevent a bad sight?
Well, the first thing is that to be aware
Okay.
of the fact that eyes should be seen, taken care of professionally. That's the
Okay.
very first thing. There are so many porous borders we have, and going to the wrong professional can lead to a lot of problems.
Okay.
And many times there's people incurring into other people's areas. And then, like we said again, going for the regular checkups is very important. And generally speaking, educating yourself more about, what are eye problems, what can be done. I know a lot of people talk about the fact that there are certain foods we can eat that will keep me from having bad sight. Not particularly. I think what is generally healthy for the body is also good for the eye.
So there's no particular food
We're
that
not- you
sends
would say-
nutrients to the eye.
Well, there are certain foods that may be more particularly useful to the eye. For instance, green vegetables are very good for the eyes. And then foods that contain a lot of carotene, like tomatoes, carrots, they are also good for the eye. They are good in that they supplement the eye health, not that they cure specific problems. So having a good, healthy, balanced diet is important. Then also trying to, see the professional cannot be overemphasized. A lot of people, make do with all sorts of stories that they hear, like we've been told. And then, there's a lot of people just want shortcuts. They're thinking, if I have to go to the hospital, I'm going to pay a lot of money before I see the doctor. So why don't I just walk across to the chemist and tell him I have an eye problem? You don't know who you're meeting in the chemist. The person might just be a school set holder who the owner asked to help him sell drugs, and you open your eyes to him. And then also recognizing, that's why we do a lot of education. If you're going to, if you want comprehensive eye care, let me quickly go and see my eye doctor. Even if it's a general doctor, it's still better than just going to see any person who, quack around.
Has a short
Because because the general doctor will recognize that, well, this is for my colleague who is an eye specialist, and will likely refer you there.
Okay.
And like we say, even getting glasses, like we've talked a lot about that comprehensively. It is better you get to see the optometrist or the ophthalmologist and get a proper checkup and estimate for eyeglasses than to just go to the street and pick up any.
Okay.
So I think being very careful about yourself. Eyes are very important. Human beings are visual creatures, and losing sight can reduce, life expectancy seriously. So I think the most important thing is that people should not shortchange themselves. They shouldn't think too much of the cost. I always tell my patients, I ask them, like, how much does a new eye cost? I don't know, what's the latest price for a new eye now? And they tell me, doctor, we can't buy. I say, therefore, no amount of money is too much to preserve your eyesight. Since you can't replace it.
Yes, just to quickly add to what she was saying, that boils to the fact there are actually some harmful practices.
Okay.
Because it has also been well documented that, smoking, all right, smoking is not it's not good regarding eye problems, because it has been found out that it increases
It's a leading cause.
Yeah, you know, age-related macular degeneration. It increases it, even early onset of cataract.
Okay.
And let me quickly also say that, you know, one of the things we also found out that causes of blindness in this our environment. You know, you see children, you know, parents should be very watchful.
Okay.
At a time when we're having cases of rubber band shooting,
Oh, yeah.
rubber band shooting, they play with it. And we had so many blindness coming as a result of rubber band, broomstick injury, broomstick injury.
Okay.
And you know, broomstick, when you use it to sweep, it carries a lot of organisms.
Yeah.
Broomstick injury within few hours can make the eye, you know, because the level of infection, overwhelming infection that occurs following broomstick injury, you cannot imagine. And so they lose their sight easily. And, you know, I did studies in Ipobaha not too long ago, even though not published.
Okay.
You know, one of the, you know, causes, in fact, causes of not accessing eye care was issue of money. And that was what Dr. Baze just talked about. That was the number one barriers, okay? Then this use of alternative source of medication. He talked about people putting breast milk. It's something that is very common. The urine, you know, urine.
I think I've also had that.
Yes, urine. So we see a lot sugar. So these are what people should, you know, avoid. When you have red eye, don't put sugar solution.
See a
All right.
doctor.
Don't go rushing to, you know, over-the-counter medication because you are afraid. And then let me quickly also say, like earlier we said, you know, like optometrist, primary eye care, then it's like now the ophthalmologist is up there. I want to also let the public know that, you know, both optometrists and ophthalmologists, the ID number we need for this nation now is still far-fetched from the, I mean, what we have, the numbers we have.
Okay.
So depending on your locality, you won't say, okay, because, oh, I have an eye problem, this hospital is owned by ophthalmologist. So let me go to Agbo first, because they said we must pass through that. So let the public also know that you can go see a specialist. All right, that is, you know, a very important message.
Okay, just quickly because of time. We're running out of time already.
For children, I'm very concerned about children.
Okay.
Parents should please be more willing to assess proper eye care for their children. There are a lot of taboos that people have in Nigeria about wearing glasses, for instance, for a child, or about going to take children to the hospital to have their eyes checked. And these children are innocent, they can't enforce it. So we want to encourage people that for children in particular who have many years to go, they should please avail them of proper eye care in women as soon as it's possible.
So let me just take your pattern shot on this one, Dr. Mike.
Okay.
Just quickly.
Okay, yes. I think that generally people need to be very, very cautious of their vision.
All right.
Like I said earlier, and this year was cited because stakeholders around the world are usually obligated to design programs that could key into the theme of the World Sight Day, you know, celebration. The theme is universal eye health. It's been there for years now, but we now pay particular attention to the call to action, and that of this year's Make Vision Count. And so we deem it fit to take vision care to children, and this is also in line with strategic policy statements unveiled by the governor during the opening ceremony of the conference of July of this year, that the state government is going to partner with eye care practitioners in the area of ensuring good quality eye care for primary school children. It is a very, very passionate case in the sense that children are part of the vulnerable group, and most of them are not really able to explain even to their parents as to what is really happening. That is why their case is very, very passionate.
Okay.
And so we have designed a program that can reach out to 150,000 children, primary school children, across the Federation today. And the idea is that we should be able to generate data and assess the level of visual impairment amongst children, so as to be able to advise governments accordingly to take necessary action and all that. And it will also go a long way in drawing the attention of all on the fundamental right to sight of every child. And when you look at this, you realize that, for instance, if the vision of a child is undermined, to a large extent, it's going to undermine that child's ability to further his or her ambition in the course. So you agree with me that children are actually the future, or the leaders of tomorrow? Whatever we do today, if we do not have, but we need to put some certain things into practice that can really prepare and package these children so as to be able to take their rightful position in the course. In this part of the world, part of the problem we have is actually succession plan. We must be able to prepare the younger ones. We must be able to prepare the children. And vision is key, because I dwelled so much on the economic importance of vision. It's been proven that 80% of economic activity involves vision.
Sight, yeah. True.
And so you can now imagine, the extent to which an economy or a nation will be losing funds on account of blindness. That is to say, however, that if preponderance of those people who are predisposed to blindness can be avoided from going blind, you can imagine how much that the nation would have saved economically.
All right. At this point, I'll just say thank you very, very much. I wish I could go on and on, but time is no longer our friend here. Thank you so much, Dr. Nosa Ogbevoin, for coming through. Thank you so much, Dr. Femi Obaze, also for your time this morning. And thank you, Dr. Michael Woko, for your time. Really appreciate the World Sight Day 2017 today. I think each and every one of us, take our time, see a doctor today, an eye doctor today. Do a routine check on your eye. Doesn't mean you'll go blind tomorrow. It just means you want to know the state of your eye. And if you agree with me, your eyes are the most important organs. Because if you can't see, then you can't pick picture to the brain, and that would be a whole lot of problem for you. Make vision count today. Thanks a whole lot for being a part of the discussion. TMI continues shortly. Do stay tuned.